Welcome back to the Patient First podcast. I am excited today. I'm doing a topic today, presenting a topic for you that kind of ruffles some feathers, kind of makes me talk directly to dentists about maybe something that's not comfortable. And unfortunately, it's kind of something I like to do. I like to agitate things a little bit. And my team sometimes says, "Whoa, Bryan, take it easy. You're ruffling too many feathers." But sometimes I can't help myself. So just, as a warning, there's going to be some truth ahead, at least from my perspective. And you might not want to hear this. It might hurt your ego. It certainly has hurt my ego in the past. But most impactful alterations that we can make in our practices with ourselves usually has a little bit of pain to our egos, right? As it said, your ego is not your amigo, right? Our ego is not our friend. So I think sometimes learning takes a little bit of growth, and growth is pretty much always painful. So what is this uncomfortable truth that I'm going to talk about today? And I think it's an important one for the not for 95% of dentists to hear. It is that not everyone is a cosmetic dentist, right? So, appropriately, everybody needs to be a cosmetic dentist. So they say they're a cosmetic dentist because what is the alternative? Doing crappy work, ugly work, making your patients look worse when they came in, when they leave than when they came in. You love amalgam and gold, and you wish that you could do a pin retained amalgam on tooth number 8. There's not a good alternative to being a cosmetic dentist. Maybe being a surgeon, right? I mean, so today I'm talking about to the restorative dentists who claim that they are a cosmetic dentist. And there are great trainings out there, obviously, for cosmetic dentistry. And if you've done the training, you have the certification, or even if you don't have the certification, you've done the training, you've done the work, then you are a cosmetic dentist. But as we all know, cosmetic dentist, non-cosmetic dentist, a lot of people advertise cosmetic dentistry that don't have the degrees because the reason that we're going to be talking about today. So I'm not saying that you should market yourself as as producing ugly dentistry. Absolutely not. I just want to talk about cosmetic dentistry today, not from the perspective of us, not the dental professionals, because I think we all know what good dentistry and bad dentistry and ugly dentistry and cosmetic dentistry is. And we know the challenges and opportunities. But on the Patient First podcast, what is our goal? Our goal is to be more profitable by putting the patient first. And many times, almost exclusively, I believe that looking at things in our industry from the patient's perspective is vitally important and often missed. And so, what I want to talk today about primarily is what is the truth around cosmetic dentistry from the patient's perspective. Okay. So here are some truths about cosmetic dentistry, or at least the way that I see it. I not that I see it as a dentist looking at the angulation of number 7 or the shade match, or the way that I see the topic of cosmetic dentistry as a way to grow your practice by looking at cosmetic dentistry from the patient's perspective. I know there's going to be, if you disagree with me, I love to hear your comments. I love reading comments, particularly when they do disagree with me. That's how I learn, right? It's great talking about stuff like this because if there's certainly times that I've read comments and went, oh, that person has a point. I wasn't always right. I'm not always right, but I do have an opinion. And so, if you disagree with me, make a comment and also like and subscribe. I love to have debates. So please let me know if you disagree. But I do think this is a big important topic, particularly when it comes to the way patients use cosmetic dentistry. And I'm not talking about the 1% of patients that understand dentistry the way that we do, right? I'm not talking about the exceptions. I think in general, we as humans have a tendency to, when a topic is presented, look at the exception rather than the rule. It's a big point. I hope you caught that. I'm going to say it again. We as humans, when we're thinking about a topic, look at the exception rather than the rule. So today I'm not talking about the patient that has done a lot of training, that knows the tooth numbers, that comes in and recognizes that number 7's root angulation is off 5 degrees, right? We know that patient is in the minority. I'm talking about the other 98% of humans walking around planet Earth. If you're a cosmetic dentist who is truly a well trained cosmetic dentist and talks to dentists about cosmetic dentistry, do you know who those dentist patients are? People in the dental industry. If you are truly a top cosmetic dentist, and I've talked to them, the people that are at the top of the top, and they lecture about cosmetic dentists and they train cosmetic dentists, the only people that care about that level is us dental professionals, right? So I'm not talking about you, I'm not talking about me, I'm talking about the other 98% of humans walking planet Earth that are your potential patients, because we want to grow, right? I don't know about you, but I personally would want to have a practice that sees the other 98%, hopefully some of the other 2%, but I'm shooting for the 98%. So number one, nobody cares about the extra degrees outside of dentistry, and I think they all have value. So if you have a degree in cosmetic dentistry, or you took a residency, or you've gone through an entire curriculum, and you have 4 new letters that you can put behind your name, fantastic, good for you. I think it's great. I think it's phenomenal. I think those plans, the ones that I'm aware of, are all fantastic, and they all are well thought out ways to go and develop the skills so that you internally and in the industry can say confidently, I am a cosmetic dentist. I know I have the skills and I can deliver the highest quality of care when it comes to cosmetic dentistry for my patients. I think there's tons of value in that for you, for the profession. So you have the skills, but when you're putting those letters behind your name and marketing it externally, I think personally, and this could be controversial, and certainly let me know if I'm wrong, unless you're part of an organization that's doing marketing to kind of communicate that, which is different than actually producing the results. I hope you see the slight variation, the subtlety there. The rest is for your ego, right? And there's nothing wrong with that, because I do think that a big part of delivering these cosmetic procedures to patients that desire them is having the confidence to deliver them. That's a big part of what we do. And, we don't want to be charlatans and be doing, full mouth reconstructions that we don't have the skills to deliver. So you should be proud. You should have ego about delivering those skills, but recognize where the value is. And it's not externally marketing a bunch of degrees. Because I've had patients come, I don't have a bunch of cosmetic dentistry certifications behind my name. I've done tons of training, but I never really cared about these certifications, because my belief, as I'm saying right now in number one, is that patients don't care. And I've worked with dentists that have those certifications, and they didn't not see me because I didn't have them. Again, there's tons of value in the certification systems. I think it is, if I were to go back and start, Bryan day one dentistry, I would probably get those certifications, not because of the marketing skill, but I think there is a lot of value in people who do those training putting forth the curriculum so you can efficiently learn the skills. I went the inefficient way, just kind of like hack through the jungle with a machete, developing my own curriculum, which was the long, hard way. So I took all sorts of courses, all sorts of training that didn't directly apply to what I wanted to. I took some bad courses, I took some phenomenal courses, but if you do go through a curriculum, I think they are very mindful of how they put those together. And then you have the validation of somebody looking at your work, which I worked with a lot of dentists, so I have that. But I think those programs have tons of value within the industry. For your knowledge, they're great. But I don't think that patients care. And again, the real reason why I know this, or I believe this to be true, confidently believe this to be true, is that I've purchased practices from masters who advertised this, and their practices were tiny. I mean, we're talking, I would put the two of the dentists of the practices that I've purchased, they were very much at the top of the game in cosmetics within the metro area that I am in the Minneapolis St. Paul metro area. They led the cosmetic organizations. They were just masters of the crafts, and they externally marketed their brilliance and their certifications in cosmetic dentistry, and their practices were tiny. And I don't think that that's bad or good. It's the way it is. So again, number one, nobody cares, meaning patients don't care about your extra certifications, even though I'm not at all discounting their value. I think they're hugely valuable, and you should put them on your name, and market if they have marketing services that are effective. Use those, but But just know what where the real value is. It's in being able to deliver the highest quality dentistry that you can, which is massively valuable, but it's not going to drive tons of patients to your door. That's my point. And number two, everybody cares. So why am I saying everybody cares and after saying nobody cares? Well, even people that say they don't care about cosmetics do. So you can have a patient that come in that's 90 years old that just says, I don't care about cosmetics. Guess what? If you produce something that's four shades off, they probably care. They just might not tell you because they don't want to care, but everybody does. So it is a skill that you need to have, cosmetic dentistry. Because like I said, what's the alternative? Ugly dentistry. And nobody, just like nobody outside of dentistry, really, I believe, cares about your certifications. Nobody cares outside of dentistry if something looks good, right? If there's a crown on number 18 that nobody can see except for a dentist, right? And they put a gold crown on there, the dentists are going to be saying, "Oh, that's great, it's gold crown." But in every other patient's mind, again, the 98% of patients are going to look at it and go, "Oh, why isn't it tooth colored?" Right? So it is a skill that we need to have, even if you think everybody else is being a PIA concerned about aesthetics, if you don't think that aesthetics matter, that it's all about functionality, right? It is, people care. 98% of people care about aesthetics. The trick is that they don't know the difference between good and phenomenal dentistry. Everybody recognizes ugly to good aesthetics, right? And sometimes there's a functional compromise. I understand that, but it's getting less and less every single day. I mean, what we can do with the ceramics today and composites, it's really hard to make a case today for producing something that's not aesthetic. Maybe you agree, maybe you don't. If you don't, definitely comment below. If you agree and you want to learn more, obviously subscribe to this podcast. Our subscriptions have just been exploding, which is fun to see. So number one, people don't care and like a lot of things in life, people don't care as much as we think they should, and then people don't care enough as much as we think they should. 98% of people are in the middle. So we have to produce good looking dentistry that is functional, that almost everybody can see. And I would say that we want to shoot for phenomenal dentistry, but just recognize where the patient is. The patient isn't expecting phenomenal. However, you'll never go wrong in delivering that. So again, I would encourage anybody to get the phenomenal skills to be the certifications, go through the tracks to get to be the highest quality cosmetic dentist if that's your focus. If it's not your focus, it's not your focus. But that's my point here. If your focus isn't aesthetic dentistry, you still, I believe, need to focus somewhat on producing aesthetic dentistry or working with people that can deliver it, because everybody cares whether or not their cosmetics, their dentistry is is pleasing to the eye. Everyone. And by everyone, again, I mean 98% of everyone. 2% of the people, the population out there, don't care at all, right? But I'm being generous with 2% there. It's probably 0.5% of people don't care. Almost everybody does care about aesthetics to some degree when it comes to dentistry. So even if you don't want to say you're a cosmetic dentist and you don't want to have anything to do with cosmetic dentistry, I believe, because if you want to grow your practice by putting patients first, you have to care to some degree. So it puts us in the middle, right? That we have to care, but so what do? I think we just have to do our best to produce the highest aesthetic dentistry that we can, and then communicate to patients or refer when we need to, right? So number three is that, again, everybody expects aesthetic dentistry. It's an expectation today. So we have to manage that expectation by getting the skills, but just recognize that the reason why we're getting these skills to grow our practices is to put the patient first. And putting the patient first means doing the best we can to deliver the cosmetic dentistry that's out there without over communicating how great we are and feeding our egos, right? It's an expectation today, which means that we have to create aesthetic dentistry. However, I don't think that in today's world, it's easy to grow your practice by communicating that externally, because so many people just expect it. If you are communicating that you produce the highest quality dentistry, meaning that you produce the highest cosmetic dentistry, you have to be, in my opinion, a top tier 2% provider to actually capitalize on that. And you have to market it incredibly well. And at that point, it's as much about the marketing as it is about the cosmetic dentistry. Let me say that again. To be a cosmetic dentist, I think you really have to focus as much on your marketing as you do on your skills in producing the cosmetic dentistry, because it's difficult to get through the noise of everybody else, because it is an expectation today. That's kind of what I wanted to bring this around to, is that, you have to show your own work. You have to communicate that this is your work by using watermarks, great photography. Oh my gosh, the late great Todd Ulrich was just he was the master of great photography of his beautiful work. He did, if you don't know Todd Ulrich, he was a master, my favorite, frankly, CEREC trainer back in the day. He just took beautiful photography of his work, put a watermark on there, and he's really the impetus of this podcast, because I was thinking about him and his great work, and I thought, what was so great about Todd? Just a phenomenal human being, but he produced beautiful work. But then he also captured his work beautifully and got it out there with his name on it. And it's possible to be a cosmetic dentist and be successful, but you really can't just be a great cosmetic dentist. You have to show it well, because there's so much noise. It's an expectation today. So realize that it is expected, and it's not a differentiator or what the market thinks is unique in the patient's eyes, unless you do what Todd did and make it look unique, show your uniqueness, right? And then add other things in your practice that complement that great dentistry. Be on time. Listen to patients. It's huge with cosmetic dentistry. I think communication skills in cosmetic dentistry is drastically underrated. Use virtual reality to reduce anxiety, provide a great digital experience. I think if you're really going to be a phenomenal cosmetic dentist, you just really have to be a phenomenal dentist, because eh, frankly, the aesthetics are an expectation by most people. So, do what more and more of what patients are looking for: text, email, convenient payments through the website and email and text, online scheduling. Being a cosmetic dentist today, because cosmetic dentistry is really more just to be about being a phenomenal dentist. So, and being able to deliver the goods on the back end is key to that. So hopefully this has been helpful. Let me know, comment, like, subscribe, and I look forward to seeing you next week right here on the Patient First Podcast.